What is cancer? Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. It is thought that more than 1/3 of all Americans will get some form of cancer in their lifetimes. Metastatic cancer happens when cancerous cells travel to other parts of the body through the blood or lymph systems. Cancer kills by growing and spreading into key organs, nerves, or blood vessels. About 2 million new cancer cases are expected to be diagnosed in the U.S. in 2022. Approximately 600,000 deaths from cancer are expected in the same year. Invasive female breast cancer incidence rates have been increasing by 0.5% per year since the mid-2000s. No one's quite sure why that is. And the disruption of health services due to COVID resulted in millions of people who missed or postponed appointments for cancer screenings or follow-ups. So what causes cancer? Although the causes of cancer are not completely understood, numerous factors are known to increase risk, including some tobacco use, excess body weight, sun damage on skin, inherited genetic mutations. Can cancer be prevented? A substantial proportion of cancers could be prevented, including all cancers caused by tobacco use and other unhealthy behaviors. At least 42% of newly diagnosed cancers in the U.S. are potentially avoidable, including the 19% of cancers caused by smoking, and 18% caused by a combination of excess body weight, alcohol consumption, poor nutrition, and physical inactivity. More than 5 million skin cancers diagnosed annually could be prevented by protecting skin from excessive sun exposure. And early screening can prevent many cancers. Let's talk about cancer and its treatment with Dr. Mary Devereaux.
Welcome to Health and Wellness. Chuck Fresh along with Dr. Mary Devereaux. Welcome back again.
Thank you.
Today we're going to talk about cancer. I've had a lot of people that I love I've seen affected with cancer. A few of my friends, family members.
Yeah.
It's a terrible disease to watch it even from the outside.
Yeah.
You just watch people become shells of their former selves.
Right.
And I've seen a lot of people go down with it. And I really sympathize with you if you have friends or family members that are going through it right now, or if you yourself are dealing with cancer.
Right.
So let's talk about cancer. Let's find out what it's. I'm sure you have a lot of questions, as I do. So what is cancer?
Cancer is when your cells kind of rebel against your body, and it's like they call it a genetically mutating. So your cells aren't performing the way they're supposed to, and it can go really rapid, really fast.
Yeah.
So through the body.
So what causes cancer?
There's a lot of debate on what causes cancer, and we talked about that it's genetic mutation of the cells, but a lot of studies are based on smoking. And smoking, of course, it dries the lungs, and cigarettes are not what they used to be. Like Native Americans had cigarettes that were, they would smoke a natural herb that didn't have chemicals, and cigarettes have changed over the years. So that chemicals in the cigarette and drying the lungs, of course, that could be a huge carcinogen, a cancer-causing agent for the body. So that's a big ticket for cancers, but a lot of, like the number one cancer is breast cancer on women. And so what's going on that's causing these breast cancers? And there's a lot of cancers that things are happening and we should try to solve it or empower people to understand, so we can only do the best we can, defense by education. You know?
A lot of people think just older people are affected by cancer, but you hear a lot of times that children, babies have lymphatic cancer or different types of cancer.
Right.
So there's really no rhyme or reason for who gets it and when they get it.
Right. Well, when they say elderly are more prone to get cancer, like I feel that's kind of like you're 70 years old, you have chronic illness, you've had carcinogens in your life, your body is built up on carcinogens from plastics and chemicals in your food. Your body is is just hot in a, it's not feeling strong, and of course it's susceptible for more of a cancer. So being older, you just have more things have happened through your life, emotional pain can cause cancers. We can talk about that a little bit later. But so that's why maybe a higher percent would be elderly, but don't think just because you're older, you're going to get cancer.
Right.
Let's talk about like what could be a precursor for that. And so if children are getting it, is it because of in womb something happened, or is it something in a plastic bottles that they're being fed, the toxins in that?
So someone's diagnosed with cancer. So what do most Western physicians do? What is the treatment?
Well, you want to get rid of that cancer cells that are there. So there's going to be surgery, it's going to be chemotherapy, it's going to be radiation, which are very invasive. So they're going to try and take care of it like right there, what they see, not what caused it or what might bring it back, but just right there, what's going on.
So people going through it, let's talk about surgery first. What do? They try to cut out the mass, or they cut the
they'll do a
surrounding area?
biopsy. And if they don't know it's cancer or not, they'll take a portion and beyond that portion out and send it to the lab, and then it'll come back whether it's a cancer or it's benign, which means not of cancer origin. So that's what they do first.
How about chemotherapy? What does that involve?
Chemotherapy is going to be a drug that goes in the body to kill the cancer. It's to kill the outbreak that's in the cells that's not normal, but it kills kind of everything in a sense. Like it just kind of almost resets your whole body. It like puts everything down in a weakness.
Okay.
Chemotherapy.
And then there's radiation.
Radiation is targeted, and everything it touches is going to be like kind of killed. So if it's good cells or bad cells, good bacteria, bad bacteria, everything in that area is going to be kind of knocked down. It's pretty harsh. So it's tough. It can be tough on people having radiation.
So Dr. Mary, you have a concierge/telehealth service, and
Right.
you have several cancer patients.
I do.
So how do you help them?
Well, most of my patients come with a symptom from chemotherapy or radiation, and a lot of times it's digestion and they don't feel like eating. So we work on some things that can help get nutrients in the body, because a calorie is not a calorie. You want to get all the nutrients you can in. So if you're tired, your stomach's deficient because your body's working so hard, eating a salad is not going to get your nutrients in, because your stomach's 110 degrees, a salad's cold. So you're eating cold food going into a hot stomach that's already deficient and working too hard. So you would take some nutrients like spinach, garlic, onion into a broth, warm it up, and then all the nutrients extract into like the water, and you make a broth, and then they drink it. So all their nutrients come in just like a drinking form, so they feel so much stronger. And it really is a lot of times just broths for their stomach digestion, because they just feel nauseated, they can't eat anything. And another things like they have like chapped lips, or they have like that taste of like a tinny in their mouth. And that's a lot of times because you're doing all these chemicals, your liver is going to give that taste in your mouth. So there's things like celery. You bite into a celery, and that's going to help with that bad breath that people complain of, because that's also going to be healing the liver, and our liver needs so much healing because you're sending all these chemicals in there and it's processing like crazy. So I enjoy doing telehealth for cancer patients, because I can help them not just mask the symptoms, and actually it's so tough. My brother went through it, and it's a tough. Chemotherapy is really tough, and radiation is tough to go through. So I want to give them real reasons, real things that's going to help them feel better through it. So
A lot of people ask, can cancer be prevented?
Prevented. I think all you can educate yourself about something is going to empower you. And like with cancer, we always like kind of live like in fear that it might happen to us, but we don't know why it could happen, what we could do to prevent it, and you should know some things. So let's just say 30% of cancers are from a virus. And that's with the CDC, 30% virus, right there off the top. So if you have ever had shingles or chickenpox, and you've already had like a virus that's dormant in you, like that can insinuate genetically changing your cells, I would work on my antivirals and things in my body and strengthen that. Antibacterials, antivirals. And then it was like, I want to say it was like 80 to 95% on some case studies. I want to say it's with the CDC, but we can put it below, right, in the comments.
Yeah.
Okay. It's based on toxins from plastic water bottles, or those frying pans that have, you know how they're like broken in the center and people are still
Teflon,
scrambling.
yeah.
And they're like scraping the egg, and the Teflon is all in there. Those are all toxins, and it's every day. Cancer doesn't come on like this. It comes on chronically. And our liver wants to clean out everything, but it gets overworked and overtaxed. So it's like cutting those things out in the house. We don't even know what we're doing, from doing our hair to our laundry detergent that smells good. Is it natural that it smells good, or is it a chemical? You know, topically, what are we putting on our skin? There's a lot of carcinogens in topical care. And so, you know, carcinogens are cancer-causing agents. And it's known everywhere, FDA, cancer-causing agents. So are we cutting those out of our food, out of our skincare? So there's so many things, our hair care, you know, and it also disrupts our hormones too, which are our messengers of our body. So we have to, for ourselves and for the people we care about, we have to be proactive with those things. You know, and then if it's a genetic thing that we're born with, then so be it. But if we can just be mindful to take care of what we can take care of, you know, so.
A lot of studies show that reduced tobacco use, or a little bit of weight loss for obese people, or staying out of the sun for more fair-skinned people can help prevent cancer. Do you agree with those?
Well, sure. I think we talked about the tobacco, that it used to be a natural herb, and now it's chemicals, and they're all carcinogens in smoking nowadays. And our lungs want to be moist, and smoking warms our lungs, makes them dry. Of course, makes them not successful, our lungs. And then you talked about if we're overweight, then our digestion's probably not working properly. And if it's not working properly, then we could have colon cancers and different things. And there's an easy way to get our digestion from the mouth to the colon working properly. And so anything that's out of whack, that's not properly functioning, even if it's just a symptom like acid reflux, we have to be proactive to fix it because it's working too hard. And then we end up with like tennis elbow or something silly, like, you know, we twist our knee. Our body can't take care of everything at one time. There's not, you know, it's going to go where it needs to, and then we have chronic pains and things, and that can ramify into a cancer. And then with skin cancer, what I've read too, I mean, yeah, the melanin and things in the skin, but we have tons of bacteria on our skin, so let's not just put antibacterials on our skin, but complement it. Apple cider vinegar on our skin. Like, do you know what a wart is? So a wart,
well, I know what it is, but
yeah, no, they're kind of a little like, do we have to have warts? I mean, you know, it's a virus. So it's a growth on our skin of a virus. So if we have viruses and bacteria growing on us, why not try to do something that's pro-bacteria, pro-virus on our skin, and not just let the sun ramify whatever is going on, you know, and it maybe cause that cancer too, so.
How important are precancerous screenings, like mammograms, or if you just feel like something with your body just isn't right?
Yeah. If you feel it's your one body, you have to look out for your one body and never take just one person's opinion, 10 people's opinion. If you feel something's not right, you have to go check for yourself. And if you don't like the answer you get, ask for another answer. Ask for another answer. Keep searching. Keep asking, because it is your one body. It's your sister's one body. It's your brother's. Always look out for more, because, you know, a physician can, you know, sometimes is biased to what they feel, but that doesn't mean there's case studies all the time coming up of what they learn. Everybody's learning new things about cancer, so you have to kind of be on top of the newest thing, and obviously research for yourself is so important. Yeah.
Do you do that through your telehealth service? If somebody had an opinion from their primary Western physician, would you be able to do research for them and look a little deeper into it?
I absolutely love researching, because if someone came in for one problem, I'm going to research everything that's going on with them, because your body's a system. So if they came in, you mean talking about for like a cancer patient?
Sure.
They came in and it's like, let's say it was estrogen enriched cancer.
Right.
I'm going to look at things that happened when they were younger, what led to this estrogen enriched cancer that they have, and help them not get it again, because it's one of the ones that kind of come back. And then when they have estrogen enriched cancer, they're told to never do anything that has any phytoestrogens or anything. And that's almost a lot of foods have that, you know, from, you know, chia to flax seeds to tofu to nuts, walnuts, and vegetables, they all have a phytoestrogen, an emulating of an estrogen. So I really don't believe that's the problem. So I want to work one-on-one to really figure out and stay with them to get stronger and let their hormones actually work for themselves, which they're supposed to do.
So always important to get multiple opinions.
Yes.
You get the Eastern and Western side and kind of
Right.
put them together and figure out what the best prognosis is and the best treatment is.
Right,
Yeah.
right. For yourself, like I said, it's just your only one body,
Yeah.
and you want to have it as strong as you can for yourself.
Yeah.
And then honestly, I would ask a physician, what would you do for yourself? What would you do for your, and they have a totally different answer a lot of times. They say something because it's protocol,
Yeah.
and they say, what would you do for yourself? Oh, I wouldn't do that. I wouldn't do that surgery. But they just told you to do it, but not for themselves. You're like, what else would you do for yourself? And you can kind of engage with them because they just kind of go along with what they're supposed to say, but maybe it isn't what they feel might be the right answer, but they know it has worked or it's for some, but maybe not for you especially.
That reminds me of some of the research you've done. You've done some videos where you've actually done Google searches
Yeah.
on what is cancer, what causes cancer.
Yeah.
And I know from personal experience, when I walk into a doctor's office, say, hey, I looked this up on the internet, they kind of like,
Boy.
why did you do that? You can't believe anything you read on the internet. Do you agree with that? I mean, should you do your own research?
Absolutely. If someone, when they do their own research, I'm actually really proud of them because I'm like, good for you for caring enough about your body to check, because your body's different and it's you. Why not empower yourself?
Right.
And I hope I can give them the tools to help them with a better search, because it is tough if you don't have a base in, nowadays it's tough. If you don't have any kind of base in health and foundational science, you're like, well, I don't understand. And if you do a Google search, you're like here, and it's all over the place until you can kind of finite it to where you're looking. Do you ever get answers? I find so.
Well, I thought it's always good to have leading questions. You go and educate it and kind of ask the right things and
Right.
have a meaningful, intelligent conversation. Otherwise, you're walking in with nothing and
Right.
you're really at their whim.
Right. And when they come to me with, like, I heard this, I like to give them the science behind whether that would work or not work and why it wouldn't work. And then I try to lead them where I feel scientifically for their body and give them a reason why, not just say, do this because I said and go on with you kind of thing.
So we ask, who is at risk of developing cancer? We have some frightening statistics here, and basically everyone, every human,
Right.
every animal is at
Right.
risk of developing cancer, although the likelihood increases statistically with age. So 80% of the people diagnosed with cancer in the US are 55 years of age or older.
Right.
57% are 65 and older. Certain behaviors and other modifiable factors also increase risk, such as smoking, having excess body weight. They say drinking a lot of alcohol or eating an unhealthy diet.
Right.
Also in the US, an estimated 40 out of 100 men, which is 40%, and 39 out of 100 women will develop cancer at some point during their lifetime. It's interesting that more men are developing cancer than women.
Yeah, well, it would depend on what cancer they're getting and the reason why they're getting that cancer. But I mean, I have this one thing about cancer too, is like when we're younger and we have hopes and dreams and we want to take on the world, we laugh more, we breathe more, we're relaxed more. It's the basic sympathetic, parasympathetic, and it's the fight or flight. I don't know if you've ever heard this, but it's like, are you a gazelle getting ready for a lion to attack you? That's a sympathetic. And we live in this stress. Oh, my job. Oh, my kids. Will they be okay? Oh, my mother's aging. Oh, my this. And we're not breathing. We're constantly that gazelle going, is this lion going to eat me or not? Am I going to survive this? And that chronic stage puts us in a chronic inflammation, a chronic pain, and then we're more susceptible for anything to attack us. People have like chronic knee pain and joint pain, and case study after case study is if they sleep more, they have less pain. Why is that? You know, if you can relax and just get oxygen to everywhere your body, that's all your body really needs. You'll die in how many minutes if you don't get oxygen, enough oxygen, right? So if we're not breathing for so long in a job we hate for years and years, our mother and our father is aging, they're grumpy, our kids are monsters, you know, we're not happy, we're not successful in what we're doing. We're constantly in this, you know, not relaxing. So why can't we more playfully be like a child, be of that, and just relax and laugh more? I feel like our cancer rates would go like this down, you know?
That's what it seems. Seems logically it would go down.
Yeah.
And with some people, with a couple glasses of red wine with a little phytoestrogen could help that stress come down a little bit too.
That's right.
So
maybe some dark chocolate.
Yeah, yeah. See our other videos for that information.
That's
So
right.
there is some hope. There's a lot of hope.
Lots.
So we want to make you aware of that. There has been a lot of progress in terms of fighting cancer. Overall age-adjusted cancer death rate rose most of the 20th century, peaking in 1991. They say mostly because of the smoking epidemic, but as of 2019, the rate had dropped 32%. Mostly, they say, the American Cancer Society says because of reductions in smoking and advances in early detection and treatment for lung, colorectal, breast, and prostate cancer. So early detection, how important is that?
I mean, obviously, as soon as you personally feel something is not working, and like if with your breast, if something isn't feeling right, your digestion, something is just off. Don't wait. I mean, because that's a symptom of a problem. Like I said, if people have chronic acid reflux and they're like, it's okay, I take an antacid. But you know that's not solving anything because you have acid in your stomach that wants to be there. So you're taking an antacid, you're getting rid of the acid that needs to be there for years. 20 years they're on an antacid. And then, of course, is messing up the whole digestion system. And that is a precursor to cancer, to colon cancer, because things, and then they're constipated. And you're just like, okay, do you want to solve this? Because it starts here, ends here. Let's just solve this whole thing, So, and with smoking, if you wake up with, let's say you have postnasal drip, or you go, oh no, it's just allergies. Stop the allergies, stop the postnasal drip, cure that for yourself. Don't live and say, I have a label, I'm gonna stick with that label. I have a hard time with that because I'm like, I wanna solve this for you. No, I'm just labeled with this, I'm gonna just keep this. I have a bad knee, a bad arm, I'm like, no, don't label that. You got this, you could fix this, let's fix that. So, I mean, I might be a dreamer and all, but I've had my fights, and you got to be proud of yourself. You got to be your own best friend. You got to say, hey, arm, thank you. And you're messing up right now. We're going to fix you, like that kind of stuff.
So routine mammograms, colonoscopies, what do you think? What's your opinion on those?
Yeah, I'm not big up. There's kind of some stuff going on about mammograms. I would research it yourself on the mammograms.
Yeah.
And I mean, you can palpate and see, first of all, cancer doesn't hurt. If it hurts, you probably have muscle pain. So if you feel like something's, just keep checking on it for yourself. If you feel comfortable getting it done, but just research it first before you do it. Don't feel like you have to do it just because you're supposed to. Because everybody's different. At whatever year, you're different each age.
So there's a lot of research out there talking about ways to turn telomerase. How do you say that? Telomerase? I don't know off. But anyway, it's a way to make cancer cells from immortal to mortal, be able to shorten their lifespans.
Yeah.
So there's a lot of really interesting research going on right now.
Lots of great stuff, yeah.
And some really innovations that could actually turn the clock back on that, and even to the point where they may have immunizations against cancer. Have you heard anything about those?
Yeah.
Still early.
It is. Yeah. And, genetics, and then getting a vaccine for cancer, usually what I've seen with the vaccines for a cancer like you're talking about, it would be it's a virus derivative.
Yeah.
Epstein-Barr, and so to me, it's so important primally to get and check with your bacteria and virus, because you cannot live without them. There's trillions in your body. And if you don't want to be in harmony with them, you're like, oh, I'm going to just sterilize my whole body. Well, you can't survive without them. What's the bird that lives on the, is it a cow or something? It hangs on there and they can't survive with each other, synergy.
Oh, yeah.
What's that called? It's like a complement. They live together.
I'm talking about animals. There's this Peto's paradox, which will give you some hope.
Peto's paradox?
Elephants have 1,000 times more cells than humans do, but virtually no cancer.
1,000 times
1,000 times more
cells.
than humans do. So scientists are trying to figure out what's going on in the elephant system.
They are happy.
That we could move over to humans. Is it stress? Maybe it is stress,
it could
right?
Come down to the basics. Yeah,
Let's
and they
look
have a big
back.
trunk for a lot of oxygen.
Let's
And
look
then they're
into that,
happy.
find out what's going on with the animals, maybe something that we could port over
I like that.
to humans.
And what animals are getting cancers?
That's right.
Are they like, house pets? Like, there's a lot of, I know of a lot of dogs that are getting cancer, and I'm just kind of like, why are they getting it? And so that would be an interesting thing to talk about too, is why our pets are getting cancer.
That's right. You want to do a show on pet food, and
We should.
how you've had some experiences
I have.
changing your pet food.
I know. I thought I had the most natural pet foods, and my dog was he had some masses growing on him, and he was going to the bathroom way too much and urinating a lot. I'm like, wow, is he diabetic? What's going on with him? And he couldn't even control it. And he's only 7 years old, and I was but I was having a natural dog food, and I'm like, I don't, and we don't really use the flea medicine, because I was explaining to my son, I'm like, if you cannot use flea medicine, you probably shouldn't, because it's making their blood toxic, and that's why the fleas don't want to bite it.
Oh.
Right. So, and I'm like, what's going on with this dog? And then I started making my own dog food, and the dog is I'm literally bounced off the ground this high. And I was like, oh, I thought he had a broken hip the way he acts. And so we should talk about that kind of stuff, because what is it? Let thy food be thy medicine.
That's right. There's more to that, more to what we're eating now, because in the last few years, there has been an increase in the rate of colorectal cancer in people under 50.
Yeah. Yeah.
And the only thing that I could see which has changed in society really is processed foods.
Yeah.
Preservatives, things we've been adding in genetically modified organisms, not to be a, not to be a conspiracist, but
I mean,
what has changed? Let's look at it.
Your body's chemistry. So is it a B vitamin, or is it a B vitamin genetically modified just a little bit? And your body is like, I don't really know what this is, just a little bit. And it just sits somewhere.
It may be too soon to figure out, are those things really affecting our bodies?
Yeah, we do sound like conspiracy theorists, but I like it because it's real.
Well, we don't know. That's the thing. It hasn't been long enough. The
know.
time hasn't gone by. We haven't had
that
studies.
little change. We're chemistry.
Yeah.
So So how does chemistry changes with all that? And so.
All right. So the signs and symptoms of cancer. If we think, we don't just want to run, oh my goodness, I have cancer, run to your doctor.
Oh,
right?
that's a scary thing.
What kind of symptoms would we experience? When do we call you? When do we call a physician and say, hey, I want you to look into something. Let's do some blood tests.
Wow. That's a.
It really does. There's various different types of
cancer. I know,
cancers.
because you could be deemed a hypochondriac. If you're like, oh, I had, like I said, acid reflux for 3 weeks. Do I call someone? You have to make anything that's not working properly for you.
It's changed
just from the
significantly over
beginning.
time, right?
Even if it's to me, it's even if it's either understand why it's happening. If you're under a lot of stress and you're waking up at 3 a.m. every night and you're having weird vivid dreams, say, you know what, I'm going through a lot, and try to yourself figure out your puzzle, but then talk to somebody who has options for you. Don't get on medications if you can help it. Don't have a surgery if you can help it. Recognize what's going on with you, and then try to solve that, because otherwise it'll manifest. But you should always be mindful. You take your dog for a walk and they go to the bathroom, oh, look what they just did. And you look at the texture, you look at the smell, that's how
true.
You have to analyze yourself a little bit that. Does it smell? Is it, is it moist? Is it this? And keep a mindful eye on what's going on with you. And then say, can I solve this myself? Or do I need to ask somebody? But if you get on a medication, it's just going to mask it.
Mask it, yeah.
Right. And to me, I'm always I want to feel this pain because I want to fix this pain. I don't want to block the pain. So anytime they're oh, we'll just do this, your hormones will just kind of, accentuate it or block it. You're no, I want to feel it and I want to fix it, because otherwise it ends up just perpetuating into something it's a beast. We don't know how to fix it then at some point.
So if you're seeing lumps or different pains or blood in your urine, a change in your stool, those are things you should talk to a physician about.
Of course, right.
Yeah.
Blood in your stool, right.
Those kind of things, nausea or just unexplained changes.
Right. If you, like a dark blood or a light blood and you don't know, just the thing too is really important is when something changes in your body, write down the details. If you say there's blood in my stool, write if it's dark blood or light blood. And then when you go to your doctor, say, here are the things going on. And then he can say, okay, dark blood means this, light blood could mean this. But honestly, bring your own kind of thoughts in your head when you get there, and don't just wait for someone to like pull the rug out from under you and scare you. You want to have all, that education that you can find under you, with you when you go.
That might explain why men's cancer incidence is higher, because men typically don't want to complain.
Don't want to go. Right.
They don't want to complain. They don't want to see a physician. So guys, something's changing, something's different. Ask those questions. It could save your life. And not just for yourself, but for your family, your friends, people who care about you as well.
Yeah, absolutely.
Yeah.
Guys aren't maybe the best on expressing their feelings in general in our society. Maybe it's a societal kind of fault to do that, but you definitely, it's your one body. You've got to be able to ask, talk to somebody. You got to trust your primary physician too. So you got to find somebody that you can relate with and say those things to.
Is there anything that people can do to help them avoid cancer? Things they could do differently in their lifestyle, eating, stress?
I know. Those are all, don't stress. Like, that's impossible. But it's not impossible. It's just like little changes. Be your best friend. Tell yourself you're proud of yourself, because we all go through stupid, hard stuff, and just say, you know what? I'm proud of me. I mean, it's tough to do in the mirror. Like, I'm proud of you. I'm proud of you. And just laugh at yourself. Be more thankful for your journey, because if you had your best friend with you, you're like, it's okay, you got this. So say it to yourself, because that's going to relax you too. And so that, and you were saying,
can I eat better? Is there something that I can do in terms of nutrition, or not eating certain things that might?
Absolutely, because everybody's body is running at a different temperature, and your body wants to run at a certain temperature optimally. So if you're running hot or running cold or running excess or deficient, maybe you always grab a sweater when you go into a restaurant or a movie because you're afraid of being cold. So your body's always running cold. So you need to do foods that warm you up. So it's an individual for yourself. You can't say, I'm going to stick to this diet of eating salads every day. Well, salads are cold. And if you can't absorb that coldness, you're going to be like, have cramps and have pain. And like I said, be cold in a theater, and everywhere you go, you're afraid that you're going to get a chill. And you might be having flushes in the night, or you might be overheated all the time. So there's foods that have temperatures. And so that's important to keep your body in that check, to be safe.
Anything we shouldn't be eating, or we should avoid to try to stay away from?
You're like leading to this.
Cancer.
I keep going around to other things.
I know.
Yes,
it's
stay
hard,
away from processed foods, because there's chemicals in there. There's toxins in there. And if you go to like the environmentalworkinggroup.org, and you'll see all the toxins and chemicals that are in your foods. Don't do boxed foods. You can make it yourself. It's pretty easy. And then freeze it. If you make more of it, freeze it. Take that time, because food is, nutrients. It's the only thing that's keeping you alive is real food. So stay away from foods in
processed
foods, processed meats. I mean, just stay off the night. I mean, people love Italian subs. You're not going to get them off of that.
The pepperonis and your delis and
but
your
there's some
Subway
that has
sandwiches.
extra nitrites and nitrates. So get the ones that are made better.
Right.
If you're going to do that sometimes. And I mean, honestly, just monitor your digestive system. If you're going to the bathroom every day, no smell, it's formed, it's good, you're doing all right,
The American Cancer Society says there's a bunch of things you shouldn't eat.
Yeah.
They're saying stay away from the processed meats, sugar-sweetened beverages, and highly processed foods and refined grain products.
Right.
They also say not to drink alcohol.
Oh, I'm
So
sorry.
how realistic is, in society today, we're moving 1 million miles a second, and there's a lot of stress, and sometimes people just need to reduce some of that stress.
Yeah, well, I was saying too is like sugar, your brain, 80% needs sugar.
Yeah.
It craves sugar. So when you crave sugar, to me, I think that's the smartest people on the earth that crave sugar. But you don't want to do the refined white sugar. You want to do the ones that have all the nutrients in with it. So when it says stay away from sugar, you can't survive without sugar.
Yeah.
So it's just that white, nothing sugar. You want the nutrients with it. And the same with the salt. You want the nutrients with it also.
Yeah.
But you just don't want to do empty calories, and not just empty calories, calories that are going to harm you.
Right.
So.
Well, thank you for talking with us again, Dr. Mary Devereaux. And you do
Yes,
offer that
thanks.
telehealth concierge service if somebody has something they want to talk about, either for yourself or somebody you
Absolutely.
know, somebody you love.
Yeah.
We'll have your website down in the comments below.
Okay,
If you have
great.
any questions about cancer or for yourself or somebody else, feel free to put them in the comments below and we'll try to address them the best we can.
Absolutely. Yes. Thank
Thanks
you for
again.
having me here.
And
Yeah.
make sure you
Great.
like and subscribe and share this information with your friends
Great.
and loved ones. We'll see you all next time.
Okay, let's look up what causes cancer. Cancer is one of those really scary things, and we probably all have watched somebody be sick from it, go through such fear and stress and pain, but it's usually met with it's genetics, there's nothing you can do about it. So I just want to do a quick 5 minutes on how we can be successful with the search and get like real answers about cancer and like look it right in the face. So when you put in what causes cancer, your first pop-up is it's caused by certain changes to the genes, your genetics. It has DNA. It kind of looks a little bit overwhelming, like, yeah, and that's nothing I can do about that. We're just going to scroll down a little bit. I don't want to invest in going on in a website if I don't need to. So I usually just kind of take a little bit of the first 2 sentences because otherwise you get exhausted reading a bunch of content. So smoking, tobacco, I see obesity and weight, sun and UV, diet and healthy eating, alcohol. So if you go down even further, it says carcinogens, which the word carcinogens means cancer-causing agent. So that's one to put, and then it shows some things. So let's take a minute on that. We'll look above at the top. It also said, if you notice, it said cancer is genetic, and it's caused, where did I see that? All right, that wasn't there. Let's see. So it's just pretty much, it gives a genetic thing there. So we go here to the next one. What causes cancer to start? DNA. Okay. So really there's nothing we can use except for it's in our DNA. And let's go 3 causes of cancer. Let's find something, right? Toxic chemicals. Okay, that is really something we can deal with. The high-fat diet causing cancer, I don't buy that. Smoking is chemicals, so of course smoking and toxic chemicals can cause cancer. Sure, those are called carcinogens. But then we have the high-fat diet. First of all, you can't work with that, and there's ways to know the root of that problem if it was a high-fat diet, so I'm not comfortable with that, using it as an answer. Here is, can stress give you cancer? I just have to pop this down and see. No, being stressed doesn't directly increase the risk of cancer. So if you just mind me indulging here, I'm going to pop on this picture and let's see what happens when we go here. So it's super funny. So it goes to images, and then you have how stress causes cancer. Then you have cancer myths busted, and then how studies suggest link between stress and cancer. Can stress cause cancer to occur? And so it's, this guy, he's been through the ringer here. It says how stress caused my cancer. So what I feel, if you're under a lot of stress and your body's not working properly, sure, it could lead to some kind of cancer, because we just saw there was carcinogens. And you know what else? It's tough to see. So we'll go back. Where do we see? So we're seeing some, you see what's coming up on the front part of the page when you're looking. I'm liking the carcinogen because that's important. We can look that up. But there's something I'm looking for that they don't usually talk about. Of course, lifestyle factors in age. Wow, that's sad. Just to throw just a blanket statement like that. Let's see. Genetics again. So really, you're thinking, I can't do anything about this. So let's see what I wanted to find. Let's see how many cancers from virus. So, wow, I didn't know it was that high. Human tumor viruses account for an estimated 12 to 20% of cancers worldwide. Viruses can lead to cancer by associating with host proteins. So why are we not doing more antivirals in our body all the time? So here, this one says, are there any? There are several viruses. Did you know this? Several viruses that lead to cancer. So cancer comes on kind of chronically. You're not going to get an acute virus and then get cancer, probably. Hep C, liver cancer, non-Hodgkin's lymphoma. So let's do this right here, just antiviral foods. Garlic, cinnamon, licorice root, black pepper. These are great preventatives, and it's kind of getting at that root of that problem when you need to find something antiviral, because it can lead to a lot of things, not just cancer, the viruses that overtake us, right? Antiviral properties. And they're easy things just to make sure they're in your life every day. And then all that's wonderful. I love seeing, but you have to know the right words. You have to get to the root. And you saw how it took I want to do the 5 minutes and I'm going past my time. But if you look at what causes cancer, originally it just says genetics. You're like, oh, that sucks. I'm just going to get it or not get it because my parents or this, that. Then you dig in there, you see that virus or carcinogens. Let's just take a quick look. Carcinogen. So it's a substance, organism, or agent that's capable of causing cancer. So I don't know if it's going to have this on here, but let's see what percent causes. And that would be kind of hard to find out though, but what percent of cancer is caused by, you'd have to, oh, wow. The risk factors that reported to collectively contribute to the development of 70 to 95% of all cancers. And that is a case study right there. That's amazing. So you have the carcinogens, and there is a list on Environmental Working Group. Let's see. Wow, that number is so high. For causing cancer development would be carcinogens. And let's see, that's the Environmental Working Group carcinogen. There we go, carcinogen list. So sorry, it's gone past 5 minutes. So I think that's why they tell you not to have like processed meats and things, because it has the nitrites and the nitrates. Then you have, of course, the plastics and those items that are in artificial. So honestly, get the stuff out of your house. Guide to hello pop-up. Continue to site and another privacy. I don't like pop-ups too much, but all right. So I would definitely, what you do is you only have to look at this stuff excuse me, in the beginning, and then you'll know you'll get the foods that you enjoy and that don't have these, added ingredients, but they are known to make up for, the cancers. And that was a high number. The virus is 30% I've seen can be a precursor to cancers. So knowing this is empowering. If you're battling cancer, I'm sorry, it's scary, and it's not too late to work on these items because you're trying to get your genetics and things back in check, because your body wants to heal and it wants to feel better. So thank you for your time. And this is the best way to search and get those real answers regarding cancer.